I've been saying to a lot of folks, my life in so many ways is the same. I do the same work every day, which is getting food that would otherwise be wasted to people who need it, yet it is entirely different. We have seen a decrease in some of our recipient agencies. So places like that we worked with, like senior centers and after school programs, are obviously no longer open. Well, we've seen an increase in need and influx of food. So in the first week of this, we had less food from the grocery stores we work with, but that hasn't stayed consistent. And in fact, we are seeing more food from places like distributors who have supply chain interruptions. The places that they would be selling their food to are no longer open. And like I said, there's increased need. So we are working more heavily with the food pantries because many of them are doing everything in their power to stay open right now, as well as a number of grassroots efforts and organizations that are thinking creatively about serving the folks that they've been serving anyways. So organizations that serve people transitioning out of homelessness who are just looking for bags of groceries to take folks or things like that. So we're getting creative about how we get the food out. I mean, the need is growing. As we're seeing higher unemployment numbers, we're going to see more food insecurity, especially given that so much of the folks who are really readily affected by this are in the service industry because they cannot continue working if their restaurant or retail store has closed. Mm-hmm. So those tend to be folks who don't have a large financial safety net anyways. So I think we're going to see an increase in need for food. And the folks on the front lines of dealing with that, like the food pantries and the other social service agencies, are really trying to respond, and we're working to get the food to them in any way we can.
And in addition to that is you have the older population and at-risk population who should not be going to a grocery store or are not allowed to. So several organizations are doing their part, as Elise said, doing home deliveries. So it's getting food to those who can't get out either, even though they might have the means. They need to stay home and be where they are.
When you go to these places to deliver your food, are you seeing people who, for the first time in their lives, are struggling to put food on the table? Or are you hearing these stories?
Frankly, that's one of my worries in the coming weeks and months, because if you've never had to access the emergency food system before, it's a daunting task.
Yeah, I would imagine so.
Hard thing to walk through those doors, and right now people aren't even able to walk through those doors, but it's hard to ask for help. And making sure that the partners we work with on a regular basis work so hard to create a sense of dignity for folks who have to access their services. And they're trying their hardest to do it right now, but circumstances, there's a lot of fear involved. So I foresee not only that there's going to be so many more people who need these services, but it's going to be really daunting and hard to do.
It's good. This is a slight tangent, but one of the things that we are very conscious of is if people don't have nutritious food, in their home and somebody gets sick, it's going to be harder to fight this virus if you don't have proper nutrition. So it's a bit of a tangent, but it's one of the things in people who, whether they never needed these services before, they need them delivered in a different way by home deliveries or whatever, it's so important that they get this food because they need, as I said, the proper nutrients for their body to fight off an infection. One thing is for Arlington to know as well is that we're continuing to do what we do 7 days a week. We have not let up. That we're getting food out to the organizations that serve people in need.